Hello everyone, in this video we are going to study about a homeopathic remedy called Sepia. Introduction. The common name cuttlefish. The inky juice of the sepia is... Hello everyone, in this video we are going to study about the particulars of Sepia. The mental generals and the introduction is already dealt in the part 1 of Sepia. An introduction to the Sepia drug. The common name is cuttlefish. Inky juice of the cuttlefish is used to prepare the medicine. It is proved by Hahnemann. It belongs to the order Mollusca. The particulars, we are going to start with head. There is vertigo with a sensation of something rolling round in head. The person feels vertigo. He has attacks of vertigo and has a sensation that something is rolling round in the head. Stinging pain from within, outward and upward, mostly in the forehead. You can see the stinging pain is starting from within and it is moving outwards and upwards in the forehead. With the nausea and vomiting. Along with the stinging pain, there is nausea and vomiting. The stinging pain, that is headache, it is worst indoors and when lying on a painful side. Aggravation of headache is from two things. That is indoors, the warm rooms and everything is going to aggravate the headache, and also when the patient is lying on the painful side. There is coldness of the vertex, headache in terrible shocks at menstrual nissus with a scanty flow. The headache appears during the menstrual period along with the scanty flow. The headache is in the form of terrible shocks. Hair falls out. During the climacteric period, there is going to be hair fall in Sepia patient. Open fontanelles, roots of the hairs are sensitive. Consequently, there is hair fall during the climacteric period. Hope the head symptoms are clear. There is headache, there is vertigo, stinging pain. It is worst in indoors and lying on painful side. There is coldness of vertex. The headache appears during menstrual period in terrible shocks. The hair is falling out, roots are sensitive and open fontanelles are found. Next we move on to the nose. Thick greenish discharge, thick plugs and crust. So the mucus, it is going to be thick and greenish. There are thick plugs and crusts. Yellowish saddle across nose. You can find a yellowish saddle across the nose. There are two types of catarrh, atrophic catarrh and chronic catarrh found in the nose of Sepia. Nasal symptoms of Sepia. Atrophic catarrh with a greenish crust from anterior nose and pain at the root of the nose. Atrophy is a reduction in the size. Because of the catarrh, inflammation of the mucous membrane, because of the inflammation there is reduction in the size, and the greenish crust are found from the anterior nose along with the pain in the root of the nose. Now in the chronic nasal catarrh, especially post-nasal, there is dropping of heavy lumpy discharges. In the chronic nasal catarrhs, there is heavy lumpy discharges found and they have to be hogged through the mouth. The lumpy discharge has to be hogged through the mouth. Hope the nose symptoms are clear. In the nose you have to remember the discharge, the mucus, it is greenish, thick. There is plugs and crust. There is atrophic catarrh, nasal catarrh, a chronic nasal catarrh. In atrophic catarrh, there is anterior nose, there is greenish crust found and there is pain at the root of the nose. Because of the inflammation, the catarrh, the crust is found. You can see the inflammation and there is crust formation in the anterior nose and pain in the root of the nose. In chronic nasal catarrh, we saw that there are heavy lumps. They have to be hogged through the mouth. Continuation, respiratory symptoms. There is dry hacking cough, especially in the evening. You see the cough, it is dry and hacking. It is found especially in the evening. The successive coughs causes a tickling sensation in the chest. Because of the successive again and again coughing, because of the continuous coughing, there is a tickling sensation found in the chest. There is operation of the chest during morning and evening. There is a dry hacking cough in the evening. operation of the chest in the morning and evening, shortness of the breath when walking, especially when going upstairs. So, there is shortness of breath. The person gasps for breath when he is walking, and especially when he is climbing the stairs, the shortness of breath increases. Congestion of blood to the chest with a violent palpitations of heart. Because of the congestion of the blood, there is palpitations of the heart. Dyspnea is better by dancing. So, the shortness of the breath, the dyspnea, it is better by dancing. There is brown spot on the chest. Chest symptoms are relieved by pressure of the hand on the thorax and by dancing. You see, the chest symptoms ameliorated by pressure on the thorax by the hand, when the person puts a pressure on the thorax by his hand, and also by dancing, the chest symptoms are going to be ameliorated. Sepia is often indicated and useful in the cases of theses, particularly in women with the characteristic sepia symptoms. So, sepia is also indicated in theses. Theses is an old term for tuberculosis. Sepia is indicated in tuberculosis in women with the characteristic sepia symptoms, like those mental symptoms, telltale face and everything. Tall, slender women, you see the constitution, all the sepia symptoms are found, and along with that there is tuberculosis, then you indicate sepia. Breath and sputum are very fetid. You see, the sputum and as well as the breath is going to be foul smelling. It is very fetid, offensive, felt even by the patient. The foul smell can also be experienced by the own patient. This symptom is also found in Suriname. So, the respiratory symptoms we saw, the cough, it is dry hacking, it is found in the evening. Then the cough is going to bring up a tickling sensation in the chest. The operation of the chest both in the morning and the evening. Shortness of breath, when is it found? During walking and climbing upstairs. There is congestion of blood to the chest which lead to the palpitations of heart. Then dyspnea, it is better by dancing. The chest symptoms are also better by pressure on the thorax by hand and also by dancing. And it is also indicated in tuberculosis. Breath in the sputum is going to be fetid and offensive. Eyes, sepia, eyes. Muscular Asthenopia. Muscular Asthenopia. Asthenopia means the fatigueness, the straining of the eyes. Black spots in the field of the vision. Guys, you see in the picture here, there is straining of the eyes because of the near work or because of the eye strain at a far distance like watching TV. It leads to muscular asthenopia, the painful eyes, the pain in the eyes is known as muscular asthenopia. There are black spots in the field of the vision. In the field of the vision, the person is going to find black spots, asthenic inflammations, and in connection with uterine troubles. So, along with the eye complaints, there is going to be uterine troubles, asthenic inflammations, and in connection with the uterine troubles, aggravation of eye troubles in the morning and evening. We saw the operation of the chest, respiratory symptoms, also aggravation in the morning and evening. The eye troubles also aggravation morning and evening. Tarsal tumors, ptosis, ciliary irritation, venous congestion of the fundus. You see the black spots in the field of the vision here. There is ptosis, that is drooping of the eyelids, ciliary irritation. Tarsal tumors, it is also an eye condition where the black spot of the eye, in the black spot which is found in the eye, there is a tumor, that is a lump is formed in the near the eyes, near the retinal area. Tarsal tumors, ptosis, that is the drooping of eyelids, ciliary irritation, venous congestion of the fundus. Fundus, it is an area found in the eye. You can look at the picture given. The venous congestion is found. You can see the blood vessels. The venous congestion of the blood vessels is found in the fundus of the eye. So, the eye complaints, there is muscular asthenopia, black spots. Along with uterine troubles, asthenic inflammations, the eye complaints are going to aggravate in the morning and evening. There are tarsal tumors, ptosis, ciliary irritation, venous congestion of the fundus of eye. Ears. Herpes behind ears on the nape of the neck. You can see the herpetic eruptions, herpes, the rashes which are found behind the ears and on the nape of the neck. Pain as if from subcutaneous ulceration. Pain as if the ulcers are formed on the subcutaneous tissue. That severe pain the patient is going to have as that of ulceration. Swelling and eruption of external ear. There is swelling and the eruptions of the external ear and herpetic eruptions on the nape of the neck and behind the ears. The face, yellow blotches, pale and sallow, yellow about mouth. Guys, sallow is the yellowish discoloration of the face. The face, there is yellowish discoloration around the mouth. Rosacea. Rosacea is another condition where there is a reddish discoloration around the nose, above the nose and near the cheeks. Rosacea. Saddle-like brownish distribution on the nose and the cheeks. You can see the brownish saddle-like distribution on the nose and on the cheeks. Hope the face is clear. You have to remember jaundice kind of appearance. Yellowish discoloration is found around the mouth, on the face, rosacea, and there is brownish spots on the nose and the cheek. The mouth of Sepia. Tongue is white, taste salty, putrid. Tongue is foul but clear during menses. You can see the tongue is white and it tastes salty and putrid. The tongue is foul smelling, it smells bad, but it is clear during menses. There is swelling and cracking of the lower lip. In the sepia, you can see the lower lip, it is swelled and cracked. There is swelling and crackling of the lower lip. There is pain in the teeth from 6 p.m. till midnight. It is worst on lying. The toothache, it is worst on lying. The toothache is found especially from 6 p.m. in the evening till midnight. In the mouth, you have to remember the tongue is white, it tastes salty and putrid. The tongue is dirty smelling, foul smelling, and it is clean during menses. You come to the lips, the lower lip is going to be cracked and there is swelling found. Teeth symptoms, there is pain in the teeth from 6 p.m. till midnight and it is worst on lying. Now we move on to the stomach complaints of Sepia. Feeling of emptiness, all gone sensation in the pit of the stomach. You see, the person feels his stomach is completely empty, all gone sensation in the pit of the stomach. This all gone sensation, empty sensation is relieved by eating. There is nausea and vomiting at the smell or sight and even the thought of the food. The person, if he sees, if he smells and even thinks of food, is going to land up into nausea. The person, you can see the picture here, she is nauseating even by the smell, sight and the thought of the food. Nausea in the morning before eating. Nausea is worst lying on the side and nausea from tobacco smoking. We saw Sepia patient has aversion to tobacco in all sorts. In any kind of form, there is aversion to tobacco. So, there is nausea on exposure to tobacco smoking and the nausea is worst on lying on the side. The nausea is found in the morning before eating. There is burning in the pit of the stomach. Everything tastes too salty. We saw in the tongue, taste salt. So, it is salty. So, the stomach complaints, empty all gone sensation relieved by eating. There is nausea and vomiting at the smell and sight of the food on tobacco smoking. And the nausea is worst in the morning before she is eating and when lying down. Stomach. There is a great aversion to food, particularly to meat and fat. You can see in the picture, the meat, fat, milk, everything she is having aversion. To bread, especially during pregnancy. She has an aversion to milk which causes diarrhea. So, the intake of the milk in Sepia is going to cause diarrhea in the patient. Natrum carb has a similar symptom, that is, intake of milk is going to end up in diarrhea. Flatulent abdomen with headache. So there is a concomitant flatulent abdomen, gas filled in abdomen with headache. The liver is sore and painful. It is relieved by lying on the right side. The liver complains. The liver is going to be sore and painful. Amelioration, lying on the right side. Liver complains. Liver situated in the right. It is relieved by lying on the right side. RR, you can remember this way. Liver, sore and painful. It is relieved by lying on the right side. There are many brown spots on the abdomen. Like we saw, brown spots on the face, brown spots on the chest. Even on the abdomen, there are going to be brown spots. Feeling of weight in epigastrium, distension and rumbling in abdomen. You can see there is a feeling of weight in the epigastric region. There is distension and rumbling in abdomen. There is rolling in abdomen as if something alive were moving. The person feels as if something alive, a baby or a fetus, is moving inside her abdomen. Thuja, crocus, veratimal, sulfur also have the similar symptom, that is rolling, sensation of rolling in abdomen as if something alive was rolling in the abdomen. The abdominal symptoms, there is aversion to fat, meat, bread during pregnancy, aversion to milk which will lead to diarrhea. There is flatulent abdomen, the liver is sore and painful, it is ameliorated by lying on right side, there are spots on the abdomen, there is distension, rumbling sensation in abdomen, and the person feels there is something alive moving in the abdomen. Feeling of relaxation and bearing down in abdomen. The person feels there is bearing down sensation in the abdomen. There is also pressure in abdomen as though the contents would issue through the genital organs. So here the person feels that there is a pressure in the abdomen which will lead to the contents to being pushed out through the genital organs. She feels all the contents inside her body are going to be pushed out through the genital organs. The rectum and the stool, there is bleeding at stool and fullness of rectum. You can see the stool, there is constipation, so there is bleeding at the stools and there is fullness of the rectum. Stool is large and hard, sensation of a ball in rectum. There is constipation, so the stool is going to be hard and there is a sensation of ball in the rectum. We saw in the abdomen, there is a sensation of a ball-like sensation in the stomach as if something alive. Now we come to the rectum. Rectum also has a sensation of ball. The patient cannot strain due to the great tenesmus and pain which shoot upwards. So there is going to be tenesmus, the pain in abdomen. There is going to be tenesmus which does not lead the patient to strain. The patient cannot strain because of the pain and the pain is shooting upwards. The character of the stool is dark brown in round balls. The stool, it is dark brown and it is in the form of a round ball. The round balls are glued together with the mucus. And even the soft stool is voided with a great difficulty. So the constipation is so severe that even the soft stools can be passed with a lot of difficulty. There is almost constant oozing of mucus from the anus. There may also be infantile diarrhea, which is worse from boiled milk in children. So we read in the previous slide that the intake of milk is going to cause diarrhea. So there is infantile diarrhea, which is worse from boiled milk. So guys, here the rectum and stool, we have to know that there is constipation. The stools are in the form of large, hard, and there is a sensation of a ball in the rectum. There is tenesmus. The stools are like round balls which are glued together with mucus. Even the soft stool is passing with a lot of difficulty. There is oozing of mucus from the anus and there is infantile diarrhea. The diarrhea is brought upon by the intake of milk. Pregnancy, there is obstinate constipation, slow and discharge. during diarrhea, during pregnancy there is obstinate constipation, slow and difficult discharge even of soft stool with excessive straining. Even to pass the soft stools, the persons require excessive straining, the sensation of a weight or ball felt in anus not relieved by passing stool. We read that there is a sensation of a ball in the rectum or the anus, and the sensation of a ball, it is not relieved even after passing the stools. Urinary symptoms. Red adhesive sand in urine. You can see the picture here. There is a red adhesive sand in the urine. Involuntary urination during the first sleep in creosote. The similar symptom is found in creosote. There is involuntary urination during the first sleep. Chronic cystitis. Cystitis is the inflammation of the urinary bladder. There is chronic inflammation of the urinary bladder, slow micturition with bearing down sensation. Hope the urinary symptoms are clear. There is red adhesive sand in the urine. There is involuntary urination during the first sleep. There is chronic cystitis and a bearing down sensation. Now we move on to the sexual symptoms. Male genital organs. Male organs are cold. There is offensive perspiration. Perspiration is sweat. Gleat, discharge from urethra only during night and no pain. So the discharges from the urethra are found only during the night and the organs are cold. The sweat from the organs is very offensive. There is no pain found. Condylomata surround head of the penis. Condylomata, it is a lesion found in the second stage of syphilis. So in STDs, Sepia can be indicated in the second stage of syphilis where there is condylomata which is surrounding the head of the penis. You can look at the picture here. There is condylomata surrounding the head of the penis. The complaints from coition. Whenever the patient comes with the complaints of coition, Sepia can be indicated. Female genital organs, very important. Menses. All kinds of menstrual irregularities are found in Sepia. All kinds, whatever the irregularities are, all sorts of irregularities are found in Sepia, which may be early menses, scanty menses, profuse menses, amenorrhea, that is absence of menses, menorrhagia, metorrhagia are also found in Sepia. When it is menorrhagia is excessive bleeding, metorrhagia is acyclic bleeding. When it is associated with other uterine and genital symptoms and a typical Sepia picture, Sepia will cure the case. So, whenever the person is having uterine and genital symptoms along with the typical Sepia picture, then we have to indicate Sepia. The first menses in Sepia is too late or too early. Either the menses appear too late or they're too early. That is, the menarche commences at an early age or at a very late age. The character of blood during menses is irregular in every form, dark flow in the morning. Even the flow of the blood, the character of the blood is going to be irregular. It might be dark flow in the morning. The quantity, too scanty and sometimes too profuse, and occasionally very feeble and scanty. You see again an irregularity found here. It may be either too scanty or sometimes it can be profuse. Profuse is more in quantity, scanty is less in quantity. Duration, it shows varying degree of irregularities. Even the duration is not specific, there are varying degrees of irregularities found. The concomitants, with menses, there is bearing down sensation. Pain comes from the back to the front. The concomitants along with the menses are bearing down sensation, which the pain is going to come from the back to the front. It is especially in those ladies who have chilly, having a weeping disposition, indifferent and apathetic with a telltale face. We know the typical Sepia picture, a woman who has a telltale face, she has a weeping disposition and she is highly chilly. The leukoria, yellowish, greenish with much itching. The character of leukoria is yellowish greenish. There is much itching found. There is acrid leukoria before menses. It is causing the soreness of the pudenda. So whenever there is acrid discharges going, it is going to excoriate the surface, erode the surface, and as a result the pudenda is going to be sore because of the acrid nature of the leukoria. And the color of the leukoria, it is yellowish green and much itching is present and it is acrid, excoriating, causing soreness of the pudenda. The female genital organs in the pregnancy, morning sickness during pregnancy. You see, morning sickness may be in the form of nausea, vomiting, dizziness, vertigo. There is morning sickness during pregnancy. The sight and the thought of the food makes the patient sick. Even the smell of the cooking food is nauseating. Ars and colchicum also has the same symptom. We have already read this symptom. The sight, smell, thought of food is going to bring on nausea in sepia. The prolapse, that is protrusion, prolapse of the uterus. The uterus is going to be prolapsed. It is going to protrude out. There is pressure and bearing down sensation as if everything would come out from the pelvis. The person feels that there is a bearing down sensation and everything is going to come out through the genital organs. The patient must cross the limbs tightly and sit close to prevent it. The person feels that there is a bearing down sensation and all her organs are going to be thrown out. So she crosses her limbs and she is going to sit close to prevent the protrusion of the uterus. Here it differs from the lilium tick. There is a differentiation made between lilium tick in the sepia. In the next slide. Sepia, there is going to be a bearing down pressure from back to the abdomen. We read there is a bearing down sensation and the pain moves from the back to the front of the abdomen. Whereas in lilium tick, the bearing down, everything forcing down as if the contents of the pelvis were to be pushed down through the funnel, the outlet being the vagina. Here, the patient feels there is a bearing down pain and all the contents are to be thrown out through the pelvis and the outlet is going to be the vagina. Must cross the legs to prevent the protrusion of parts. In both sepia and lilium tick, they feel that the contents are going to be thrown out, but the differentiation is here. In sepia, they are going to cross the legs to prevent the protrusion of parts, whereas in lilium tick, they are going to support the vulva with the hand or they cross the legs. The support of the vulva with the hands is found in lilium tick. Here the patient feels cold more. Here the patient feels heat more. Sepia, highly chilly patient. So they feel cold more. Lilium tick feels heat more. Mentally the patient is very indifferent and apathetic. We have read indifference to work, indifference to her loved ones, indifference to husband, children, everyone. We have learned the mental symptoms in the previous video. Mentally the patient is very indifferent and apathetic in sepia. Here in lilium, the patient is always hurried and worried. There is complete absence of sexual desire in sepia, whereas in lilium tick, the sexual desire is much more marked. Aversion to being affectionate, aversion to being loved is found in sepia. They do not like being loved. They are indifferent. They start acting indifferent to their husband whom they loved dearly once. So there is complete absence of sexual desires in sepia, whereas in lilium tick, the sexual desire is much more marked. Hope it is clear. You have to remember that in sepia, they cross the legs. In lilium tick, they support the vulva. And the patient is cold here in sepia, chilly patient, lilium tick, hot. And there is indifference and apathetic. The patient is hurried and worried in sepia. There is absence of sexual desire. The sexual desire is much marked in lilium. The skin complaints, itching of the skin in various parts of external genitalia. We saw there is the leukoria is going to cause itching of the pudenda. There is itching of the skin in various parts of the body and also of the external genitalia. It is not relieved by scratching and it is apt to change to burning. From the scratching, it is not going to relieve the complaint and the person is going to land up in the burning sensation. There is soreness of the skin and itching in bends of joints. You see the bends of the joints, there is going to be soreness of the skin and itching also found in the bends of the joints. There may appear brown spots of the skin. We saw brown spots on the face, on the nose, on the chest, abdomen. Brown spots are also found in the skin. Ringworm, boils, you see the boils, blood boils, ringworms, boils, blood boils, ulcers, etc. are regular recurrences. So Sepia is a wonderful remedy for ringworms, boils, blood boils, ulcers, which are recurrent. They appear again and again. Lymphatic swellings and crippled nails are often met with itching between fingers and in the bend of joints. Along with the itching between the bend of joints, there is lymphatic swelling and crippled nails. There is profuse perspiration while walking. There is intense sweat present when the patient is walking. There may also appear herpes circinatus in isolated spots on the upper part of the body. You see herpes circinatus found in the nape of the neck and behind the ear. Hope the skin complaints are clear. There is itching of the external genitalia, soreness, itching in the bends of the joints. There are brown spots. It can be given in ulcers, boils, blood boils, lymphatic swellings, crippled nails are found. There is increased sweat on walking, and herpes is found in the nape of the neck and behind the ears. Now we move on to the modalities of Sepia. Aggravation, morning and evening. We saw so many complaints aggravating in the morning and evening, like the operation of the chest and everything. Washing, laundry work, dampness, left side, after sweat. Aggravation after sweat. Cold air before a thunderstorm. You see, Sepia is a chilly patient, so the laundry work, washing, dampness, cold air before a thunderstorm, all these things are going to aggravate the symptoms. Cold, it is chilly in the morning and evening, so it's a chilly patient, aggravation in the morning and evening. Left side after sweat is what you have to remember. Amelioration is by exercise, by pressure, warmth of bed, hot application, drawing limbs up, cold bathing, after sleep. After sleep, the symptoms are going to be ameliorated by pressure and by exercise. With this, we come to an end of the particulars of Sepia. If you like my video, hit the like button and subscribe to my channel. Thank you.